Combining pain medications with alcohol can lead to significant and potentially life-threatening interactions. The severity of these interactions depends on the specific type of pain medication and the amount of alcohol consumed. Here is a detailed examination of the chemical interactions, statistical data, medical treatments, and long-term effects associated with this combination. Opioid analgesics such as morphine, oxycodone, and hydrocodone work by binding to mu-opioid receptors in the central nervous system, leading to analgesia, sedation, and respiratory depression. When combined with alcohol, which is also a central nervous system depressant, they can have an additive effect. This significantly increases the risk of profound sedation, respiratory depression, coma, and even death. According to drugs.com, alcohol can enhance the release of opioids from extended-release formulations, leading to overdose. Non-steroidal anti-inflammatory drugs, or NSAIDs, like ibuprofen and naproxen, inhibit cyclooxygenase enzymes, reducing the synthesis of prostaglandins involved in inflammation and pain. When taken with alcohol, both substances can irritate the gastrointestinal lining. This combination increases the risk of gastrointestinal bleeding and ulcers. According to verywellmind.com, chronic use of both substances can also lead to kidney damage. Acetaminophen, also known as paracetamol, is metabolized in the liver, producing a toxic metabolite called NAPQE that is usually detoxified by glutathione. Chronic alcohol consumption induces the enzyme CYP2E1, increasing the production of NAPQE. According to verywellhealth.com, this overwhelms glutathione stores, leading to hepatotoxicity and potential liver failure. Benzodiazepines such as diazepam and lorazepam enhance the effect of the neurotransmitter gamma-aminobutyric acid, or GABA, at the GABA-A receptor. This results in sedative and anxiolytic effects. When combined with alcohol, both substances potentiate GABAergic activity. This can lead to excessive sedation, respiratory depression, impaired motor function, and an increased risk of overdose. According to SAMHSA, which stands for Substance Abuse and Mental Health Service, the dangers of mixing these substances are significant and should not be underestimated. Approximately 40% of adults have taken a medication in the past year that could interact negatively with alcohol. In 2010, there were approximately 438,718 emergency department visits involving the non-medical use of opioid pain relievers. Of these, 14% involved the concurrent use of alcohol. While specific statistics on deaths solely from the combination of pain medications and alcohol are limited, the Centers for Disease Control and Prevention reported that in 2010, alcohol was involved in 22% of opioid-related deaths. When managing a combined overdose, the immediate assessment is crucial. First, ensure the patient's airway is clear to prevent aspiration, and monitor their respiratory rate and cardiovascular status. Administration of antidotes may be necessary. Naloxone, an opioid antagonist, is used to reverse opioid-induced respiratory depression. Flumezanil, a benzodiazepine antagonist, is sometimes used, but its use is controversial due to the risk of seizures. Supportive care is also important. Activated charcoal may be administered if the ingestion was recent to limit drug absorption, and intravenous fluids can help maintain blood pressure and hydration. Continuous observation in an intensive care setting may be necessary. For liver support, N-acetylcysteine or NAC can be administered in cases of acetaminophen toxicity to replenish glutathione and prevent liver damage. The long-term impact on the mind and organs can be quite severe. Neurological effects include cognitive impairment, as chronic use of CNS depressants with alcohol can lead to memory deficits and decreased cognitive function. There's also an increased risk of developing substance use disorders. Hepatic damage is another concern. Chronic alcohol use combined with hepatotoxic medications like acetaminophen can accelerate liver damage, leading to liver cirrhosis and hepatitis, which is inflammation of the liver due to toxic exposure. Renal impairment is also a risk, as prolonged use of NSAIDs with alcohol can lead to chronic kidney disease. Gastrointestinal issues such as ulcers and bleeding are more likely to occur with the combination of NSAIDs and alcohol. Finally, Cardiovascular effects include hypertension, as alcohol can elevate blood pressure, and combined with certain medications, may increase cardiovascular risks. The concurrent use of pain medications and alcohol poses significant health risks, including acute overdose, long-term organ damage, and increased mortality. It is crucial for individuals to consult healthcare providers before combining these substances and to seek immediate medical attention if adverse effects occur. Finally, remember to listen to your doctor and take the time to read and heed the warnings on prescription medicine bottles. It may save your life or the life of someone you know.